For our CDI program, we decided to do Ruby Memorial Hospital. This slide demonstrates our findings of JW Ruby Memorial Hospital, and these findings consist of clinical services, accreditations, and other key data and stats. To support our mission and vision, our CDI program is built on some core values consisting of accuracy, collaboration, education, and patient-centered care. Accuracy is extremely important with ensuring patients are clearly and correctly reflected in the health record. Preparing healthcare professionals with knowledge to document everything accurately, clearly, and efficiently will ensure better outcomes and patient safety. Our mission statement is to enhance the quality and accuracy of clinical documentation to display the complexity of patient care, ensuring compliance, appropriate reimbursement, and improve overall healthcare outcomes. Our vision statement is to lead force in advancing clinical documentation expertise by fostering collaboration, education, and creativity, which ultimately supports a healthcare system that is data-driven, transparent, and centered around patients' needs. For our staffing program, the CMO will be head of the department. The HIM director will be in charge of reporting all information from the CDI program manager to the CMO. The CDI program manager will be receiving reports from the CDI specialist staff. Our CDI staff will consist of 15 CDI specialists, the ratio being 1 CDI specialist for every 1,500 discharges. The job title of the CDI reviewer will be the Clinical Documentation Integrity Specialist, also known as CDIS. The CDI reviewer will be in charge of ensuring that there is constant improvement of the quality and accuracy of our clinical documentation and patient records. They have to have a degree in either HIM, nursing, or any other clinical fields. They also must have certain credentials such as CCS, RHIA, or RHIT certifications to qualify for our program. Additionally, they will need to have at least 2 years of clinical experience and 1 to 2 years of coding experience with a strong background in ICD-10 or PCS coding. The training plan that we will be using for our hospital will be the CAMP training method. The CAMP method stands for coaching, asking, mastering, and peer learning. This is a scientifically validated method for clinical documentation training, and this method draws upon the adult learning theory of self-efficiency and uses the components of coaching, asking, mastering, and peer learning to teach physicians the principles of high-quality clinical documentation. C stands for coaching, will involve reinforcing and encouraging participants about their abilities to perform the function. Asking involves requesting feedback from the physician participants in a specific manner and at a specific time. Mastering involves practical application of the principles discussed during the training program. And lastly, peer learning involves instruction by a knowledge peer and is important for the physician trainees to learn from their peers who are also in the program. A CDI specialist and physician peer will assist with the training. The length of the training will be 4 weeks. The information included in the training will consist of ICD-9, CM, 10, clinical documentation, DRGs, and MS-DRGs. Weekly evaluations with CDI specialists to track improvement. With having weekly evaluations during our training, this will allow feedback and timely correction of documentation issues, which will support improvement rather than waiting. And then once the training is done, they will need a monthly assessment for a clear understanding of SDI. For this sample training plan, week 1 will be the SDI introduction, which will be SDI overview, medical terminology review, HIPAA, and clinical documentation standards. Week 2 will be coding, which will include coding systems, DRGs, MS-DRGs, CMI, and coding guidelines. Week 3 will be charting, concurrent versus retrospective review, query review, and legal and ethical querying. Week 4 will lastly be the clinicals and query documentation, which will include query formats, different hospital scenarios, query review and feedback, and then general assessment. Our program will use a mixture of multiple choice and open question queries. These specific types of queries allow for the physician to get a good idea of the cause of the diagnosis and provide their own insight on the situation rather than giving them minimal options to choose from. Here's an example of queries that our CDI program will be using. They both consist of multiple choice and or open-ended questions. Program reviews, analysis, reporting, and measure. To ensure accuracy in POA status and effectively manage hospital-acquired conditions, our CDI program will implement a daily review process, which will include real-time SDI reviews, constant monitoring of staff performance, and SDI software development. To measure program effectively, we will measure how many mistakes POA status we had, such as documentation errors, billing errors, and clinical review, and see where we have improved in the areas we need to improve. The hospital executives and management staff will play an important role in overseeing the SDI program's performance. These executive reviews will serve as a foundation for the strategic development of the SDI program, ensuring alignment with hospital goals such as patient safety and reimbursement safety. Project metrics that will set will be patient satisfaction, decrease in clinical documentation mistakes, and training progress. These are some example dashboards. Our additional recommendations for CDI is introducing AI into more CDI program softwares. AI can help detect mistakes in CDI that may have been looked over by the specialist. This can help decrease the amount of errors in patient documentation and can drastically improve CDI programs in all different areas of healthcare. CDI will begin to grow and expand into more areas in healthcare than it currently has and will become a huge part of healthcare overall. For our patient program development, we will focus on improving patient care, documentation coding, and quality scores.